Nigeria wakes up to another health threat, monkeypox, an infectious disease caused by the monkeypox virus. The disease was first identified in laboratory monkeys, but in its natural state, it seems to infect rodents more often than primates. The primary route of infection is thought to be contact with the infected animals or their bodily fluids. Human monkeypox infection was first discovered in the Democratic Republic of Congo, where it is now considered to be endemic. It is more common in rural rainforest areas of Central and West Africa, and for the first time, there's an outbreak in Yenagoa, Bayelsa State in Nigeria. Thirteen people are discovered to have the symptoms and quarantined.
We have been able to create, an isolation ward at the Niger Delta University Teaching Hospital where the patients are presently being treated, and we are also following up the 49 line cases that who have been in contact with these patients. I know that there are more people, and they might be in hiding because of stigmatization and fear, But I want to use this medium to appeal to Bayelsans that there is no need to panic, that the situation is under control. We have the capacity to ensure that the spread of disease is interrupted. For the health facilities, we have mobilized personal protective equipment to all health workers who are going to directly be treating and managing this kind of patients. And the only other challenges I think we have now is to ensure that we create awareness and sensitize the general public to carry out measures to ensure that we don't, allow this condition to spread.
Cross River State is the home to so many variety of wild monkeys, because we have 58% of the rainforest in Nigeria preserved in Cross River State. So we are taking extra care, extra precaution to make sure that monkeypox does not get to Cross River State, because it's already in South Nigeria. It presents like maculopapular rashes, just like chickenpox and measles, and usually starts from the face with predilection to the soles of the feet and the palms of the hands. The rashes may come in thousands, and they're usually bigger, more itchy, more pustular, and they usually come with lymph node swelling. Very painful lymph node swelling. This is one of the distinguishing features that differentiates it from chickenpox and measles. These lymph node swellings are usually very, very painful. There's no vaccination for now, there's no treatment, so the best way is prevention. Personal hygiene, hand washing, environmental hygiene, making sure that if you have a suspect of monkeypox, you will not have close contact with the person.
It takes 6 to 16 days for symptoms to show after an infection. Early symptoms include fever, serious headaches, back pain, muscle aches, and lethargy. A characteristic rash usually starts on the face and may spread to the palms and soles of the feet. The treatment of monkeypox is symptomatic until the virus has run its course.
Avoiding eating meat that has not been properly cooked. Coming in contact with animals, even after they are dead, infected animals could get them infected. Coming in contact with infected persons, even by having them sneeze and then they shake hands with them, they could equally get infected.
Risk factors for transmission include sharing a bed, room, or using the same utensils with an infected patient. Incubation period is 10 to 14 days. Currently, there's no proven safe treatment for monkeypox. Smallpox vaccine has been reported to reduce the risk of monkeypox among previously vaccinated persons in Africa. The decrease in immunity to pox viruses in exposed populations is a factor in the prevalence of monkeypox. The outbreak of Ebola virus in Nigeria in 2015 was an eye-opener to the decadence in the country's health sector, and the poor level of preparedness towards outbreaks, as lives were lost in the process. The British government assures of its readiness to help Nigeria combat the spread of monkeypox and other health-related issues. The British Deputy High Commissioner to Nigeria, Laurie Buffield, notes that it is an emergency that requires the collaboration of all. She calls on state governments to complement the federal government's effort by investing in healthcare services. Laurie maintains that Britain has been providing £400 million yearly to Nigeria in fighting poverty, improved education, and provision of sound health facilities.
The British government is supporting the government of Nigeria in addressing health and education and basic services in general to ensure that the health of the population here goes from strength to strength. We're monitoring the situation very closely with the World Health Organization, and we'll be reviewing our support as and when we go. We will be monitoring the situation very closely. As it stands, we provide through the Department for International Development about 400 million pounds in aid every year to Nigeria in support of poverty reduction, health and education. Our support is wide and broad and deep. Of course, we cannot respond to every priority, and I hope that the government itself, as well as the state governments, will take responsibility and invest in health solutions to protect their people.